Hey, how are you? Hi, everyone. It's your girl, Coach Eli, coming to you live and direct from Maryland. How are you guys doing? It's been a while, and I just wanted to come on today. I have received a lot of questions, and I just wanted to take a minute to answer this particular one because I feel like you all will benefit from that. All right, guys. How is everyone doing, guys? Before I proceed, I want you all to take a minute to subscribe to my YouTube channel. If you're just joining, make sure you subscribe because you want to be in the know when I drop these videos. One particular question that I want to quickly address is the one with you setting up a clinical account, right? Clinical, we consider that as phlebotomy, um, where you draw blood. How do you even set that up? What is the process? A lot of people have questions. They want to know how to, figure that particular way out, because we tend to offer different services. Like we have the drug testing, we have the DNA, we have the blood draw, right? So four major types, which is what's the first one? The point of care testing, right? You have your clear, then you're able to do the rapid test. So quickly, I want to elaborate on how both works. For example, if you want to set up a drug testing account, right? You are going to be certified. Yeah, you're gonna have to obtain your DOT specimen collector course, right? Then you want to reach out to the labs. They call them the toxic, the house lab, which is the reference lab, and you will set up your account, right? And what you would do, you're gonna take the specimen, right? That is the urine. You're gonna send it to the lab. Once you send it off to the lab, what else do you then do? The lab is gonna run it under your account. Then they will send your results to your MRO, right? That is if you elect your MRO to release your results, which I highly recommend. And that is because if you say yes to MRO, you are gonna get a discount, right? So you're gonna check off MRO because MRO don't need to do that for your DOT, but for non-DOT, it's optional. You can get your result without the MRO review. So, but if you do the combo package, most likely you're gonna get a discount fee, right? So you want to say yes because DOT, your MRO needs to review the results. It's regulations. Nobody can update. Nobody can tamper with that regulation. So you're gonna say yes, and the MRO is gonna release your result. But for when you have a clinical account to do blood draw, sometimes honestly you don't even need an account because it's one difficult to get an account. Number two, it involves you to collaborate with a doctor or a nurse practitioner. And sometimes you don't want to just collaborate because that's the only services you need them to, or that's the only thing you need help with. So you want to be careful. So in that case, the way that we do is once you draw the blood, once you have the order from the doctor, you're going to draw the order and you ask your clients to pay you, right? Your draw fee. And you take their insurance, make a copy of their insurance card, and put it together with your specimen and send it to the lab of your choice. Just drop it off because you don't have an account with the lab, so you cannot request a pickup services, right? Because with phlebotomy, you have a pickup services. You have a system. Once you have an account, you have a system. You have access to the portal. You can put in that order in the system. Quest is gonna have it, or whichever the lab you choose will have it. Then it's in the system. Once the result is ready, it's gonna go back in the system, and you offer that to. It's gonna go back to you and the doctor that is ordering it. Because remember, while you're setting that up in your portal, you're selecting the name of the doctor who is ordering that because those are clinical. A doctor needs to have it. You need an order to do those. So a shortcut to that is just keep the problem, the headache of getting a doctor or a nurse practitioner. Just get the order. Whomever is bringing the order, most likely that's the patient that you're gonna draw, right? So just get their order, draw that order, get yourself your money, get paid, make a copy of the insurance, and send it together to the lab. Once the lab verifies that their insurance is good and everything, they're gonna release the result back to the doctor. In that case, you're doing hands off. That is how you can run your phlebotomy. right? And in another case, though, there are some labs which are not the major ones, but local labs. They can work with you. They can bill for both the draw and the order, the processing, the test itself, and they will pay you. So you can run your business either way of that. You can do it through your partnership with the reference lab that you're gonna use for your clinical. They build insurance on your behalf. They pay you, but it's difficult these days to find those type of insurances, those type of labs. But they're there. But if you can't find, right, I'm bringing that alternative measures to you, alternative ways that you can still run your business. Okay. Another topic, and that's just that, so you know that's a way that you can streamline that. And also, I think I can't really remember, but that's pretty much what I want to discuss today, right? And for those of you that wants to offer DNA, very simple. You can also either you resell a DNA or you're a collector for DNA. And for DNA, you can stay home and sell DNA anywhere nationwide. You don't have to worry about location. You don't have to worry about those things. So for those of you that are new in this industry, you can honestly just stay right there and do DNA and a little bit of drug testing here and there. Start off with non-DOT. So if you are to ask me, what is the shortest cut to start in this industry without putting too much money out there, without you stressing yourself, without even you, if you want to just start small, I have different advices for different people. Like if you're the one that wants to go big, I have the medicine for that, right? Because if you're going big, you want to start your business big, there are certain things that you have to put into consideration. If you're the one that want to start small because the lab is now rejecting you, do non-DOT. And if you're doing non-DOT, guys, if you're doing non-DOT for employment purposes, you don't need clear. You don't even need clear. You can just buy them rapid cups because it's only for the purposes of employment. But the moment you're going to treat that person and they're coming in for an employment drug test, you would need a clear. All right. I hope this is helpful. Please, if you have questions, kindly drop them in my comment section. So let us do a quick recap, right? Let me do a quick recap, then I'm going to end this video. But do not forget to subscribe. And if you have any questions, kindly please reach out to me. My phone number is 301-883-1047. If you want to reach me by email, it's info@officialcoacheli.com. info@officialcoacheli.com. So quick recap of this video is number one, if you want to do drug testing for DOT, you need to set up an account with the lab. Your result goes through your MRO and they release your result to you. If you want to do a non-DOT, right, you don't need clear because it's all for employment purposes, only for pre-employment. You can start small that way. Also, if you're trying to do a phlebotomy, you can do it both two ways. You either reach out to a reference lab, local reference lab that does clinical account that can process your blood specimen. You take the order from your client, you draw, you get paid, and you send that specimen off to the lab. Or because you don't need an account. Basically, that's what I want you to take note of. You don't need an account when it comes to phlebotomy, but for drug tests, you need an account. And if you're doing non-DOT for drug tests, you don't need an account. You can run it as a rapid test, and you don't need clear. I hope this has been helpful, and I'll come back and talk to you again on, for those of you that wants to go on a big scale, I have a big scale level for you. And big scale are not typically afraid to make big moves. All right, I've seen a lot of people say Eastern is asking me to pay $500 per month. Some people are advising that don't do it. Why are you in the business if you cannot afford to pay $500? And we have techniques of how you can make good money to afford all of those fees that they're asking of you. Remember, it's all strategic, right? You're asked to pay something to get something. Again, so we have to be big in our reasoning. And I'll talk to you again. It's your girl, Coach Eli, coming to your life and direct from Maryland. Love you.